Welcome back, everyone. In tonight's medical moment, we're taking a look at hypertension and how it impacts pregnant women.
Joining us now from USA Health is Dr. Mimi Munn, a maternal fetal physician. Dr. Munn is also professor and chair of obstetrics and gynecology. Dr. Munn, thanks for being with us tonight. How common is hypertension in pregnant women?
Right. So hypertension in pregnant women is actually very common, probably complicates about 2% of pregnancies. And then other hypertensive disorders related to chronic hypertension complicate even more, probably up to 10 or 15%. So it's actually very common.
And what would be the risks associated with hypertension, not just for pregnant women, but also the babies?
Right. And we have two patients to think of, and it's very important because it does cause some major complications with moms, including stroke, seizures, damage to end organs like kidneys, and then affects the baby as well, with making babies sometimes too small and stillbirth. So some very, very serious complications.
So if someone does not have trouble with their blood pressure before they're pregnant, they can still have high blood pressure when they are pregnant. I think that's always a surprise to people because I've had friends who didn't have high blood pressure and then all of a sudden, boom, they do.
Right, absolutely. Yeah, and screening for preeclampsia or toxemia of pregnancy is an important reason to get your blood pressure taken as well, because a lot of women don't have risk factors for things like preeclampsia.
And what's new in the field? What are some of the new guidelines concerning any of these topics?
Yeah, so some really great things coming out. The United States Preventive Task Force has recommended, screening for hypertension in pregnancy, which, we already were taking women's blood pressures, but now the focus is on treatment because there's some great data that came out last year that treating blood pressures in the mild range even help a woman have a more successful pregnancy and less complications. So that's where the excitement is.
Well, when do you tend to see the high blood pressure? When is a mother typically in that kind of danger zone? Is there a certain week of gestation where you see that?
Right. So we know that preeclampsia or toxemia of pregnancy, manifests itself more often in the third trimester, but it's important to check in the first trimester as well, because we want to treat those women that have underlying chronic hypertension, because that has shown improvement in their outcomes.
What would be an example of a blood pressure that you feel would not be something that would maybe raise a red flag for people who aren't pregnant, but for someone who is, maybe it's a little bit lower than you would think, but it's higher when you're pregnant?
Yeah, so actually our cutoffs for instituting treatment are probably a little bit higher than what what is reported in the medical literature in the non-pregnant patients, because we again have two patients to think of. We don't want to drop women's blood pressures too low, because that will affect the growth of their baby. So we treat blood pressures if they're greater than 140/90 or greater, which again is a little bit higher than our non-pregnant colleagues will treat. But again, we have two patients to think about, and again, the data are very reassuring that treating to that blood pressure shows improvement.
All right, Dr. Mimi Munn with USA Health. Thanks so much for all the great information tonight.
Great, thank you.